Hi, everyone. Uh, Thank you so much for joining us today for our sleep hangout. We are going to be talking today about the importance of sleep and what might help you to get a better night's sleep, which all of us seem to need. I'm joined today by three of our experts. I have Dr. Mary James. She's a naturopathic physician joining us from North Carolina. Hi, Mary.
Hi, nice to be
Hi.
here.
Thanks for being here. We're also joined by Dr. Julie Schwartzbard. She's a neurologist, and she's joining us from Florida. Hi,
I
Julie.
am. Sunny Florida.
Sunny in Florida, yes.
Lucky you.
And also today we are joined by Amber Hayden. She's a DO, and she is joining us from North Carolina. So welcome, Amber.
Hi.
Hi. So why don't we jump right in to the topic of sleep. And Mary, do you want to get us started by telling us how, or rather, why sleep is so important for our physical and mental health?
It's a great question because I think it's the value of sleep is really underestimated by so many people more and more in this productivity-driven society. So I think some of the most noticeable benefits are on the brain. So actually helping with cognitive function, test performance, people get better, students get better grades the next day after getting a good night's sleep. Creativity, emotional intelligence, which may relate to why so many people who have less than, say, 6 hours a night of sleep have a high risk of depression. So it makes us better people. It puts us in better moods. One thing I found really fascinating was a study. It was an animal study, but might be extrapolated to us, where they found that the brain actually cleanses itself of toxins during sleep. So the brain is the only organ that's not part of our lymphatic system, so it can't take advantage of that kind of drainage of toxins. So only during sleep, and I think this is really a pertinent aspect of this, it's only during sleep that the cell volume changes to allow the cerebrospinal fluid to seep in, gather up the toxins, and move them out into the bloodstream. But then there's systemic effects also from sleep. So sleep deprivation can increase the risk of immune problems, cardiovascular problems, clotting, inflammation, diabetes, and interestingly, women seem to be much more prone to those problems than men. Not clear why.
That's so interesting. And we're always looking for ways to detoxify and kind of, maximize the benefits of the sleep as well. So, yeah, that's really interesting. So how much sleep should we actually be getting? I know you threw that 6 hours out there, Mary, but...
Well, that was not a recommended number. That was talking about a study, actually more than one study, where they found that less than 6 hours a night increased the risk of depression significantly.
So that's the bare bones.
So average recommended amount is about 7 to 9 hours, but it really should be individualized. I'll let somebody else address that first since I've been talking.
Oh, that's okay. Yeah. Amber, what do you think about that? What do you recommend to your patients as far as how much sleep we actually need?
Well, the amount of sleep you need is really based on two things. When we're a toddler, we need a lot more sleep than when we're an adult, but every adult is different, and it really depends on two factors. The one is the amount of sleep that you optimally can perform at. So some people that is 6 to 7, others it might be 8 to 9, but then there's also this other factor of sleep debt, where you're having a couple of nights a week where you're getting less sleep than is optimal for your body's performance, and that can actually accumulate onto your requirements of sleep and really change that number. So on average, an adult typically needs 7 to 8 hours of sleep, but again, if you are only getting, for example, for me, I'm on night float right now, so I'm getting about 5 to 6 hours of sleep, and probably next week I'm probably going to need more like 9 or 10 hours to get myself back to my baseline.
Right, you really are having to catch up. We say catching up on sleep, but you really are having to do that.
And it really is a debt that you accumulate, and like Mary said, that it really can have negative effects on your health, and you can pay it off to an extent, but if you're chronically getting less sleep than you need, it's really hard to catch back up. So short periods of time, you can really make up that sleep debt, but if you're doing it over a long period of time, it's much harder.
Right.
Can I just add one thing related to that? It's been said that not sleeping well for 6 nights in a row is the equivalent of pulling an all-nighter. So you've got to, as Amber was touching on, you have to make up that sleep. You can't not sleep well during the night and then sleep a solid 8 hours on the weekend and think that you've had enough.
Right.
It's a false sense of recovery, and it catches up with you, and you begin to show performance deficits as a result.
That's true, and I would just add that it's not only the amount of sleep, but the way that you're sleeping. So we really want to try to have a regular routine. Trying to fall asleep at the same time and wake up at the same time is really equally as important. You were talking about night float a few minutes ago, so I was reminded of a study that I was reading in preparation for today, looking at medical residents and doctors in training, and the study showed that medical residents who were sleep deprived made about 35% more medical errors than those residents who had had a good night's sleep. Wow. And many other studies have shown the incapacity that can develop from lack of sleep. There was another really interesting study that really compared sleep-deprived people to people who have been have had alcohol. So if you are particularly sleep-deprived, your accuracy time is going to be slower, your reaction time is going to be slower, and you're as if you are inebriated.
Wow, you don't think about that in terms of, I mean, if you think about it in terms of, having a doctor who's sleep deprived or something like that, but just, being on the road, driving home from your shift.
Absolutely.
Yeah, that's a scary thought. So, and one of the reasons I think that some people are missing out on sleep, or one of the ways we try to remedy that, is by tuning into our electronics kind of at night when we should be going to sleep, or if we wake up in the middle of the night and just roll over and check the Facebook. How does the use of electronics really impact our ability to get a restful sleep? Is that a problem?
It's a huge problem, because anything that's stimulating is going to make it difficult for someone to fall asleep. So electronics are terrible in the bedroom. Really, the bedroom should be mostly for sleep. If you can't sleep, the best recommendations are you actually remove yourself even from the bedroom if you're going to perform a quiet activity, but not to do so within the bedroom. And there are even studies that have shown that if you wake up in the middle of the night and look at the clock just to check the time, that can be stimulating and then get your mind thinking. So the Facebook and the Instagram and the Twitter, and we could go on and on with the social media, all of those are stimulating activities, and they're going to thwart a person's ability to get a good night's sleep.
Yeah, one survey suggested that 95% of us check our electronic devices within the hour before bedtime, and is probably only growing. So it's way out of control, and it's thought to be the blue light from electronic devices with a 40 lux short wavelength radiation that is interfering with melatonin and our ability to sleep. The interactive devices are a whole lot worse than the passive devices. So if you're playing video games, you're texting, you're working the internet on your phone, as opposed to watching a movie or reading a book on your device, something passive, it's the interactive devices are much more disruptive, but all of them tend to emit this blue light. There are amber tinted glasses you can wear that shut out the blue light. There are actually apps you can put on your devices if you're determined to take that thing into bed, or even if you don't, during the hour before you go to sleep, there are apps that you can put on your computer and other devices that pay attention to your location and are able to adjust the light on your device so that it's a softer light when the sun sets and a bright light during the day. There's a company that sells different light fixtures for different parts of your house, like hallway lights or the bathroom light, or places where you think you're going to be late at night before bed, that also shuts out the bright light or the blue light. So there are ways around it, but like Julie was saying, really the best thing is to not take your device into the bed with you. Get your work done beforehand and do something passive. And even if you read a book in bed at night, which is going to disrupt your sleep a whole lot less than an electronic device, one of those book lights that clips onto the book comes in that type of light that shuts out the bright light. So that's a way, and shutting out the other lights, that's a way to kind of drift into sleep in a nice quiet way without the light interfering with your melatonin production.
Interesting. So we've got a lot of folks that are trying to find us ways to troubleshoot that so we can keep doing what we want to do. But,
Yeah.
that's so interesting. One just final question, ladies. What are some of the things, I'd like to leave our viewers with some tips on things they can be doing throughout the day and through the evening. I know Julie had mentioned going to bed at a regular time, and we've talked about the electronics, but what are some other things that women can be doing to help have a more restorative sleep? Amber?
Well, there's a couple ways that you can approach it. What I typically do when I have a patient that comes in and tells me that she's having a difficult time sleeping, the first question I ask is, are you having trouble falling asleep or staying asleep? Because that can mean a lot, because that's sort of the pinpoint of where your first aspect of issue is coming from. And then we look at lifestyle, diet, how caffeine intake, not only caffeine intake, but when are you drinking your caffeine? Because, everybody tends to have that lull at 3 p.m. You have that cup of coffee, and that can keep you stimulated well until you're supposed to start winding down and go to sleep. Another aspect would just simply be the simple, how are you taking care of yourself during the day? Are you eating a lot of carbohydrates and sugars that tend to peak you and then go down, or are you eating a good balanced protein? And then exercise, not only if you're exercising every day, but when you're exercising. So, we're busy people. Getting an exercise in every day is really important, but the timing can really affect your ability to wind down and fall asleep. More and more people are going to the gym at 8, 9, to 10 o'clock at night, and while that's great for your body, you're waking yourself up, you're getting your endorphins going, and you simply can't wind down after exercise. And then the final thing is just your environment when you go to sleep. Like I said earlier, your bedroom should really be reserved for the 2 S's, sleep and sex, and that's really, and maybe reading if you're able to do it the way Mary had described earlier. But you really don't want a TV in there. You want it dark. You want a good temperature, comfortable sleep environment. If you have someone who tends to check their phone at night, that's going to keep you from falling asleep as well. So just basic environmental and lifestyle changes is sort of the baseline of approaching your sleep issues.
One thing I would add to that, those are all excellent points. Stress comes to mind as being such a huge factor for people. And I think that relaxation and good sleep at night go hand in hand. We can't be wound up all day and then expect to just drift right off into sleep as soon as we get into bed. We just can't shut it off because we haven't primed our systems to be relaxed during the day so that we're kind of already in that mode when we get into bed. And one thing a lot of people, I think, don't realize is that cortisol, stress hormone, is inversely related to melatonin. So melatonin needs to be high at night to help us sleep. Cortisol ideally needs to be at its lowest. And then the opposite in the morning. If those are switched, then the melatonin high in the morning makes us groggy and we can't really get out of bed, bounce out of bed and start our day. If cortisol is high at night, we can't really relax. So priming the nervous system to be relaxed during the day, I think, is a really important prelude to getting a good night's sleep that night. And also breathing. I think the diaphragmatic breathing. So instead of up in the chest, breathing with the chest going up and down, taking that breath down into the abdomen, and making a point of breathing that way as much during the day as we can think of, makes it a lot more likely that we'll also breathe that way at nighttime and not get into hyperventilation and sleep apnea and a light sleep that isn't really refreshing.
And I would only add, I agree with all of that. Sometimes, we have patients who come in and they're doing everything right, and they're getting the right amount of sleep, and they're following all the recommendations you've just heard, and they're still waking up feeling sleepy. They're having daytime sleepiness, and that's really the time that you need to speak with your doctor, because that really could be indicative of a problem with the quality of your sleep, and that needs to be investigated with testing, and often there's simple diagnoses with simple treatments that come from that. But after a good night's sleep, you should wake up feeling well rested, and if you don't, then that's really a sign to talk to your doctor.
Excellent. Well, ladies, I know we're a little bit crunched for time for some of you, so we're going to wrap this up, but I wanted to let everybody know that we've got some great hangouts coming up on digestion, on how to spark a tired libido if some of us need some help with that. And just go ahead and subscribe to our YouTube channel if you want to stay up to date on what we've got going on with these hangouts. Julie, Mary, Amber, thank you so much for joining me today for this discussion. It was really informative.
Pleasure.
Thank you, everybody.
Thank you. Okay. Take care.
Bye-bye.